Hi friends, welcome back to my channel. Today we are going to discuss about nasopharyngeal suctioning, which is a clinical skill in NMC Osce. So let's see how we can do it. See the marking criteria. First it is saying clean hands with alcohol hand rub or washes with soap and water and dries with paper towels following the WHO guidelines. So then introduce self, explains the procedure to be carried out and the rationale for this. So we can see how we can do. First it is a 8-minute procedure and the equipment we need is suction tube, the French 10 or 12, then sterile water and sterile gallipot, gloves, apron, mask and goggles because the nasopharyngeal suctioning which can cause the fine particles can that's airborne, so we have to wear these goggles. Then as it is mentioned in the marking criteria, first we have to gel the hands with the 6 steps of hand hygiene and check the scene for safety. This is common for all skill station. We have to perform this. Then we can verbalize I am checking the area for safety and it is safe to approach. Then next we can introduce ourselves. Hello, my name is so and so and I am your nurse today and I am here to remove the secretions in your airways using nasopharyngeal suctioning. So it's clear for the patient. Then we can, because it's a difficult situation for them because we are going to do some procedure and they are afraid maybe it is a painful procedure or it can cause discomfort, so we should explain and gain verbal consent from them first. So we can tell a tube will go up your nose and into the back of your throat, is that okay? So it will be clear for them. Then we can also tell them during the procedure you may find it hard to talk. If you need me to stop at any point, just raise your hand because when we are performing this procedure, they may not be able to talk. Then we can assure them, I will be monitoring you throughout the procedure using your baseline observations as a guide, and this will include color, breathing pattern, respiratory and heart rate, then secretions and evidence of distress or trauma. So we can tell them. Then next thing is that we can assist them to sit in an upright position or semi-upright position with a pillow to support your head and making sure your head does not tilt forwards or backwards. We should verbalize these things during this procedure. So here we covered until the 5 points of marking criteria. Next is we are going to wear the disposable plastic apron, non-sterile gloves, mask and goggles. So first we will wear the apron after hand hygiene. Then we will wear the mask. Then we will put the goggles and last the gloves. Then next step we have to check the patency of their nostrils. So how we can ask them, can you sniff with one nostril closed so I can check if your nostrils are patent, and repeat on the other side. So we can make sure, otherwise for some if there is any blockage and we are inserting this catheter through one, so it will be causing this difficulty of breathing for them. So we want to make sure are their nostrils are patent. Then next thing is that collect equipment suction catheter size 10 or 12, gallipot and sterile water. So according to the appropriate size of catheter we selected. Then next is set suction to 12 to 20 kilopascals or 100 to 150 mm of Hg, and we have to ensure that the suction machine is working. Then we assemble the equipment and we will attach this tubing to the wall suction canister and suction tubing using a non-touch technique. That means we are not touching on the key parts to make it unsterile like that. And attach tubings to the wall suction canister. The next thing is we are going to do is lubricate the tip of the catheter with the sterile water. We are not using any other lubricant. We are just dip in the sterile water and gently insert the catheter into the nostril. As the patient inhales, we will ask them to inhale during this procedure. So we can please inhale as I insert the tube into your nostril. Continue until the patient coughs or if we felt some resistance is felt. Until that time you can insert the catheter. If resistance is felt or there is distress of uncontrolled coughing, I will stop inserting the tube and 1 centimeter of tube will be withdrawn before applying suction. We have to explain each and every step to the patient so it is clear for them and there will not cause any discomfort for them. Okay, then we will apply suction. Place the thumb over the valve, slowly withdraw while maintaining suction. Apply intermittent suctioning at 10-second intervals. Rotate the catheter and I will repeat the procedure 2 to 3 times as required or tolerated. So we should inform them. Then next thing is flushes the suction tubing with the sterile water. Then ensures that patient's face is clean and that they are safe and comfortable post procedure. We can ask them, are you comfortable? Then dispose of equipment and doff. So even verbalization is accepted there. Then we have to do the hand hygiene. We can gel hands and that also they will accept the verbalization. You can just inform them, I'm going to gel the hands like that even though you did not perform. But it's better to perform everything and to verbalize at the same time. I think it's clear for you, and if you require additional information you can just comment below the comment box. And thank you for watching my channel and keep supporting. I think it's beneficial for you. Thank you very much.